So hello everyone, welcome back to my YouTube channel. Today we'll be discussing a really important chapter in community medicine, that's Preventive Medicine, Obstetrics, Pediatrics and Geriatrics. It's a really long chapter in parts, but thankfully the number of subheadings are a bit less, so this video is going to be a bit brief. Now, first it starts with the maternity cycle and starts with maternal and child health care problems. What is maternal health? That's defined, and objectives. And broadly, three maternal child problems are malnutrition, infection, and uncontrolled reproduction. Then goes on to discuss short note on pregnancy detection. We then proceed to antenatal care, in which the antenatal visits, the objectives of antenatal care are important 3 or 5 markers in frequently asked in at least in RGHS exams. Then number of visits, which is usually 4, and the timings, an estimation of number of pregnancies in an area, and pregnancy tracking. And it also discusses what all we check in a routine antenatal checkup visit. Firstly, the history, the confirmation of pregnancy, history of previous ones and any complications associated with them, current surgical or medical condition or systemic illness, and LMP or EDD calculations, symptoms, family history, drug allergies, substance abuse. Then we move on to physical examination of pulse, respiratory rate, edema, BP, weight and breasts. Then abdominal examination, in which we see the fundal height, we examine the fetal heart sounds and fetal movements, and then presenting parts, the lie and presentation, multiple pregnancies if any, and any other scars or any other findings. Then we proceed to gestational age assessment, and we do lab investigations, which differ according to whether it's in a subcenter or whether it's in a PHC or CHC or first referral unit. Then there's also a short note on risk approach and the record keeping, that's the mother and child protection card, and home visits. Next, we proceed to prenatal advice, which a health professional should give to a mother based on her diet, her personal hygiene and habits like exercise, sleep, bowel habits, avoidance of smoking, alcohol, dental care, and advice on sexual intercourse. Drugs, radiation, and warning signs and child care are also discussed upon. We then discuss specific health protection measures for mothers, expectant mothers, against diseases like anemia and other nutritional deficiencies, ASB, which is asymptomatic bacteriuria, gestational diabetes mellitus, toxemia of pregnancy, tetanus, syphilis, rubella, which is also known as German measles, RH incompatibility, HIV, hepatitis B, and other genetic anomalies which can be transmitted. Then we also do something important which is overlooked, that is mental preparation for the arrival of the baby, then family planning measures if they're interested, and pediatric component to how for kids accompanying the mothers. Next, we proceed to intranatal care, in which we discuss the domiciliary, which is home deliveries, the pros and cons of home delivery, and institutional care, which is the recommended way of delivering a baby, and what is rooming in. Next, we have postnatal care, in which we try to prevent postnatal or puerperal complications like puerperal sepsis, thrombophlebitis, secondary hemorrhage, and others. We basically try to restore the mother to optimum health, and we teach about breastfeeding adequacy, family planning, and basic health education. Optimum health includes physical, psychological, and social health. And under physical health, we have postnatal examination, we check for anemia, we check for nutritional levels, and postnatal exercise advice. Now, coming to the care of children. In the first phase of life, that is infancy, we have neonatal care. Firstly, we have early neonatal care, and there are a few objectives listed. Then we have immediate care, in which we ensure airway. There's an important APGAR scale, which is more discussed in more detail, usually in pediatrics. Cord care, eye care, skin care, temperature, and breastfeeding. These are all core OBG and pediatric topics. Then we have neonatal examination, in which we have first we do it at the delivery room, Second examination is within 24 hours, and we check for infections like tetanus, syphilis, hepatitis B, and HIV. We also then perform some routine measurements like weight, length, head circumference, and neonatal screening. We assess whether it belongs to any at-risk category. And then we have late neonatal care, and we deal with low birth weight like preterm and intrauterine growth restriction. What are the causes of low birth weight? What's the importance of prevention and direct intervention and indirect intervention and treatment? And also an important short note, that's kangaroo mother care. Next, we proceed to the feeding of infants. We talk about breastfeeding and artificial feeds, which can be dried milk or cow milk. And cow milk has proteins, fats, carbohydrates, vitamins, and minerals. This is also a comparison of cow milk versus human milk and the concept of weaning. It should be noted that human milk is always most preferred for humans. And another short note on baby-friendly hospital initiatives, which is also frequently asked in exams and vivas. So there are growth and development. We have the definitions of growth, development, and the determinants of the same. What is normal growth, and how do we assess growth? We assess mean or median, percentile, and age-independent indices like weight for height. There's a small graph which shows how the general body growth proceeds and how brain growth and reproductive system growth and maturation differ with respect to general growth. And then we have reference values according to standards set by Harvard, WHO, and ICMR. We then have surveillance of growth and development, which can be physical, behavioral, and using growth charts. So for physical surveillance, we have weight for age, height for age, weight for height, and head circumference and chest circumference. A low weight for age indicates malnutrition. A low height for age indicates stunting. A low weight for height indicates wasting. We then have behavioral, in which we assess motor development, personal social development, adaptive development, and language development. Then we finally have the growth charts. There are two types of growth charts, WHO and Integrated Child Development System or Scheme in India, ICDS. And what are the uses of a growth chart, which is also an important topic, frequently asked everywhere. We then proceed to the care of a preschool child and the common child health problems, which are low birth weight, malnutrition, which can be protein energy malnutrition or micronutrient malnutrition, usually vitamin A, iron, and iodine, infections, accidents, poisoning, behavioral problems, and other problems like maternal health, family, socio-economic issues, environmental issues, and social issues. We then proceed to what are the rights of women and children and national policy for children, which is ICDS and POXO, Prevention of Child Sexual Offences. We then proceed to maternal and child healthcare delivery. What are the recent trends? So there are integration of care, risk approach, manpower changes, and the increasing importance that should be given to primary healthcare. And there are various indicators of maternal child healthcare like maternal mortality rate. So it's how we measure MMR, what the causes of maternal mortality, and how do we prevent is a must know. We also have infancy and child mortality rates. Under infancy, we have perinatal mortality, neonatal, postneonatal, infant 1 to 4 year mortality, under 5 mortality, and child survival rate and stillbirth rate. So maternal mortality rate is measured until the 42nd day of termination of pregnancy. Here's a short diagram depicting the timeline of the calculation of each mortality rate for period of infancy. So stillbirths are from 28 weeks of gestation to birth to term. Early neonatal is birth to 7 days. Perinatal is from 28 weeks of gestation to 7 days postnatal. and 7 to 28 days is late neonatal. Beyond 28 days till 1 year is post neonatal. Neonatal proper is birth to 28 days, that's within the first 4 weeks, and birth to 1 year is infant mortality rate. Now coming to IMNCI, Integrated Management of Newborn and Childhood Illnesses. So we have an outline of the general management process in which we assess a child's illness, we classify accordingly, we identify and treat accordingly, the treatment instructions and counseling of the parents and follow-up care measures, plus how to deal with congenital malformations. So there are IMNCI guidelines for, as far as I remember, diarrhea, pneumonia, malnutrition. We then move on to discuss the various aspects of school health services, like a health checkup, remedial measures plus follow-ups, prevention of common communicable diseases, nutrition, healthful school environment for the kids, first aid, mental and dental health, eye health, health education, and how to deal with handicapped children whose physical, mental, and social health will be affected, and maintenance and usage of records. Plus, the measures for in school health under Ayushman Bharat, in which there weekly we have interactions and iron folate administration. Monthly or fortnightly we have Q&As and thematic assemblies on health. Quarterly, like every 3 months, we have parent-teacher meetings, PTMs, and thematic AHDs or academic half days. And then biannually we have deworming activities, that's single dose 400 mg albendazole. And an important social issue, that is juvenile delinquency. So we have the causes, that's biological and social, and how we can prevent children from slipping into juvenile delinquency by prevention in terms of family life, school life, and social welfare. The next few pages then talk about child abuse and child labor, but these are broadly forensic topics because they talk about battered baby syndrome in detail with other topics as well. Then there's something called INSPIRE, which is basically the 7 strategies to end violence against kids. So I stands for implementation of laws, N stands for norms, values, S stands for safety, P stands for parent and caregiver support, I stands for income strengthening, R stands for response, and E stands for education and life skills. So we then move on to child placement, in which if a child is not home, it can go into either an orphanage or a foster home or adoption or borstalls or remand homes. And we also have child welfare agencies take care of underprivileged kids, like the Indian Council for Child Welfare, the Central Social Welfare Board, Kasturba Gandhi Memorial Trust, Indian Red Cross Society, UNICEF, WHO of course, CARE, FAO, and International Union for Child Welfare. There are many more organizations, but these are the few prominently mentioned. And then we move on to the activities that child welfare agencies can undertake, like daycare, holiday homes, recreation, and Bal Bhavanas. We then move on to discuss what is ICDS. ICDS stands for Integrated Child Developmental Services. So we discuss the objectives of ICDS and then how it's implemented. It's implemented in Anganwadi centers or AWCs, and the criteria for how many AWCs for a given population is listed below. So we have one Anganwadi for 400 to 800 population. We have 2 for every 800 to 600 population. 3 for every 1600 to 2400 population. In hilly terrain, 1 for every 300 to 800 population would suffice. And 1 mini Anganwadi center for 150 to 300. So what are the various services that are offered in Anganwadi centers? We have nutritional supplementation, nutrition and health education, immunization, health checkups, and non-formal preschool education. So that completes the maternal and child healthcare component of this chapter. We then move on to geriatrics, which is basically health problems in the old age, which can broadly be divided into the aging process, long-term illnesses or chronic illnesses, and psychological issues associated with old age. And there are various programs and organizations in place to help the aging population, like National Social Assistance Program, Indira Gandhi National Old Age Pension Scheme, Help Age India, an NGO, and travel concessions for senior citizens in many modes of transport. So that's the end of this chapter and this video. Hope this helps. Thanks for watching. See you soon.